Welcome to the 129th season of the Canadian Club Toronto, Canada's podium. For over a century, this stage has united visionaries and leaders from politics, business, community, and the arts to share insights on the most pressing issues of our time. And with Canada in a pivotal moment, it's more important than ever that we come together.
We've been having important discussions and debates around this podium in this country for well over a century. I call this a historic podium of record.
Our club's always been a forum for visionaries, public figures, and decision makers to command attention to the issues of our time.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
Good afternoon, everyone, and welcome back, and a warm welcome to those joining us online. My name is Shazanne Chu, President of Canadian Club Toronto, and your host for today's sold-out event. Healthcare renewal is often framed as a policy challenge. Today's discussion reframes it as an economic imperative. From labor force participation to innovation, investment, and systems design, healthcare transformation is central to Canada's future prosperity. Our ability to convene conversations like this is made possible by the generous support of our sponsors. Today's event is presented by Johnson & Johnson. Thank you for your leadership and commitment to advancing health outcomes in Canada. We're also grateful to our event sponsor, Shoppers Drug Mart. Thank you for your partnership and support. To our season sponsor, the Canadian Bankers Association, and our airline sponsor, Air Canada, thank you. And to Canada's Forest Trust, our nature partner, who helps us reduce our carbon footprint by planting a smart forest in our honor, we thank you as well. We're also pleased to welcome students from the University of Toronto Master of Health Science and Administration program. We're glad you could join us to be a part of the discussion today. Now, before we begin, a few housekeeping notes. You'll find information about upcoming events and our on-demand library at canadianclub.org. And if you're not yet a member, we'd love to welcome you. We also appreciate it when you share our events on your social media network of choice. And now I'm sure you'll all have questions about how healthcare modernization connects to Canada's economic future. Please use the question cards on your table, and our team will collect them and share them with today's moderator. And for those joining us remotely, please click the Submit a Question button on the right side of your screen, and we'll be looking out for those as well. Now, before you leave today, we truly value your feedback. Please take a moment to complete our survey. You'll find QR codes on your tables. We read every response and deeply appreciate your insights. Now, it is my pleasure to introduce Laetitia Dequoy-Guillou, President of Johnson & Johnson Innovative Medicine Canada, to the podium to offer introductory remarks and formally introduce today's speakers. Laetitia, thank you. Canada's podium is yours.
So good afternoon, everyone. And I hope that my voice will stay. It's a little bit vanishing today, so I apologize for that. It is for me truly a pleasure to be here with all of you today, both in person and as well virtually. On behalf of Johnson & Johnson Innovative Medicine Canada, thank you for being part of this conversation. And thank you to the Canadian Club Toronto for convening such a thoughtful and timely conversation. I'm especially pleased to be here because I am still relatively new to Canada. I've been here for something like 3 months, and I've already been struck by the depth of passion for healthcare across the country. Encountering the Canadian healthcare system with fresh eyes has been both eye-opening and inspiring so far. What stands out immediately is how deeply Canadians care about healthcare, not just as a service, but as a shared value. There is a strong belief in equity, in access, and in the idea that Canadian healthcare can and should be a model for other nations to follow. At the same time, it is impossible not to recognize the pressure the system is under. We are seeing growing demand, workforce challenges, and increasing complexity of care, as well as rapid scientific and digital innovation, all converging at once. Which is why today's topic, the economic imperative for healthcare renewal, feels so relevant. Last month, at the World Economic Forum in Davos, Mark Carney spoke about the importance of long-term resilience and the need for countries to invest in the systems that underpin economic strength, social cohesion, and national confidence. Healthcare sits squarely at the center of that conversation, not only because it supports people's well-being, but because it enables participation in the workforce, in community, and in the economy itself. For us, this leads to a simple but important idea. Healthcare should be viewed not primarily as a cost, but as an investment. When countries invest in health strategically, they expand workforce capacity, accelerate innovation, adoption, and improve long-term economic resilience. Because when we talk about healthcare renewal, we are really talking about people and the kind of economy and society we would like to have built around us. Canada has as a French, it's a very difficult word. I am sorry for that. Canada has extraordinary strength, one of the best educated workforces in the OECD, world-class clinicians, hospitals, and researchers, strong public institutions, and a growing ecosystem of life sciences, digital health, and innovation. The question before us is not whether change is needed. That is clear to everyone in this room. The more important question is how we move forward together. At Johnson & Johnson, our purpose is to transform the trajectory of health. We see every day that earlier diagnosis, faster adoption of innovation, and newer models of care don't only improve outcomes for patients and their loved ones, but they also reduce downstream system pressure. That belief shapes how we show up as a partner to government, healthcare providers, industry, innovators, and always with patient at the center of our work. That's why conversations like today matter so much for us. They create space for different perspectives. They challenge assumptions, and they help build the trust required for meaningful, lasting renewal. What makes today's discussion especially valuable is the diversity of experience represented on this stage. You'll hear perspectives shaped by frontline care and patient advocacy, by hospital leadership, by policy and system design, and by innovation and entrepreneurship. Together, these voices reflect the complexity of healthcare and the importance of learning from one another if we are going to move forward in a meaningful way. Thank you all for lending your expertise and your perspective to this important conversation. So let me introduce our panel. I'm very pleased to introduce our moderator. I hope that I will say your name right for you, Rola Daher, who will guide today's conversation. A former Global Channel Chief Officer at Dell Technology and former President and CEO Cisco Canada, Rola is a transformative technology executive and a global voice for inclusive, human-centered leadership. With more than 2 decades in the tech industry, she has led large-scale transformation, built high-performing teams, and guided organizations through accelerated growth and reinvention. Thank you for facilitating this conversation, Rola. And it is now my pleasure to introduce our panelists. Ami Archibald Varley is a thought leader in advancing health equity and political health activism in healthcare. She inspires others to speak their truth and bring communities together to engage in courageous conversation. She is a dynamic speaker, scholar, and medical media contributor. Ami, we look forward to hearing your perspective and are very grateful for your presentation of frontline healthcare workers and patient advocacy. Carly Fowler was appointed President and CEO at Trillium Health Partners in 2022. Previously, she was the Executive Vice President of Patient Care Services and Chief Operating Officer, where she was accountable for clinical operation and the delivery of exceptional patient experiences. She also oversaw capital planning and redevelopment to ensure that all future planning at THP is closely linked to the delivery of patient care. Carly, thank you for joining us today and sharing your perspective as a hospital and health system leader. Dr. Dominic Novak is the Ontario Medical Association's immediate past president and family doctor at Women's College Hospital. Dr. Novak trained at McMaster University, where he specialized in family medicine and served as chief resident. He went on to the University of Toronto to finish a Master of Health Administration at the Institute of Health Policy, Management and Evaluation, as well as the ICD Rotman Director Education Program at the Rotman School of Management. We are so grateful for your participation, Dr. Novak, and look forward to hearing more about your experience as a healthcare provider and policy insights. And Michael Serbinis, founder and CEO of League, a leading AI-powered platform technology company accelerating the digital transformation of the healthcare consumer experience. Founded in 2014, League's platform empowers payers, providers, and consumers' health partners to deliver high engagement, personalized healthcare experiences consumer love. As a serial entrepreneur, rocket scientist, engineer, and investor, Michael is the lead voice on the future of healthcare and its intersection with tech innovation. Thank you for joining us, Mike. So thank you all for lending your expertise and your perspective to this important conversation. What makes today's discussion so powerful is the blend of experience of our panelists. I hope this conversation challenges assumptions, sparks new ways of thinking, and help us all move Canadian healthcare forward. And with that, I think that we are missing one panelist. Shruti, is it correct? Or not? No, we are good. Okay, so sorry. So with that, I will turn it over to Rola. Thank you so much.
That's great. Hey, come on up, guys. I was so eager to start the conversation. I came, warmed up my seat, and I'm like, I'm ready. And I'm like, okay, they're all still sitting down. So come on up. All right. Are you ready for an uncomfortable conversation of learning about the truth of healthcare? Amazing. All right. That's great. So I've been in Canada. I came to Canada about 38 years ago. And this is the first time ever in 38 years that I feel that the system has failed us as citizens, as doctors, as leaders, as entrepreneurs. You're going to witness extremely passionate people today that wake up every day to fight on behalf of all of us in the room to make sure we have a better system for our next generation. Because if you want, I don't know about you, my daughter is 38, my son is 32. By the way, he proposed to his girlfriend yesterday, so. I'm a mother-in-law, she said yes. Okay. I was freaking out. So I paid the guy in the restaurant extra tips to hide behind the curtain and videotape the yes before I got there. So don't tell my son I've ever done that, but I did. I'm like, what if she says no? no. Yeah, so it's amazing because for me, for 38 years, I continued to work every day to make Canada a better place for my kids and grandkids and for all the next generation. Hence the reason why I'm so passionate about technology. And it's not a choice of us. For us, it's a must. It's a must because we are not here to admire the problem that we're going through. We are here to rewire the system and rewire the system that is broken because of some bad decisions that happened in previous years that we're all paying for it. When you rewire the system for your children, you want them to understand that healthcare is not a privilege, it's actually a pillar of our prosperity to make sure that we attract Canadians to the country, but we also retain them because this country was built on so much passion to ensure that we continue to impact. I want to say it's for all of us today in the room. I want you to be brave, not safe. Because you never know who you meet and you have a conversation and it could change a lot for everyone. See, if we open a brand new hospital today in every province, I promise you it would be full in one day. Correct, Carly?
Yes.
So we can't build our way out of the crisis because this is no longer just a healthcare issue in Canada. It's an economic issue, it's a workforce issue, and it's a competitiveness issue that we face as a country. And when you go to the Middle East and you see how they do things and you come back to Canada and you go to different countries and you're like, why are we stuck behind? This morning at 8:30, I've been waiting for a specialist appointment for 11 months. I got it this morning at 8:30. 45 minutes, the technician's just typing for 45 minutes before the specialist walked in the room. So when he walked in, I said, hi, my name is Rola, I'm a technologist, but I have to tell you, you could have saved 45 minutes by using an AI tool. Hence the reason why we continue to have issues in the country. So our doctors are burnt out, our leaders are frustrated, Canadian citizens are extremely, extremely sad to see what's happening, and more than ever today, this conversation is going to change the perspective on where we need to be and where we have been. So there's no formality here. I'm going to pick one of you. I'll ask the question, but it's for all of you, but I'll pick one to start. Carly, small job. You have a building that's coming up that's costing $17 billion. That's with a B, guys, $17 billion. Yeah. You have been extremely vocal about transforming the way healthcare used to be. You have brought incredible people on your board and on your innovation committee. But for me is, I want you to take us through. The building is finished. By the time the building is finished, is business is going to be as usual, or is the building going to actually have a different perspective? Because you're not just building infrastructure, and you said it earlier, and I love what you said. I cannot build on the old infrastructure that we have. Can you explain that to us and take us through the difference the new building will do, and especially for our patients?
Yeah, great. Can you hear me? Yeah. Thank you. It's great to be here today, and great to kick off. So at Trillium Health Partners, we're very proud to be building Canada's largest infrastructure project. In total, we are building over 620 net new hospital beds. We are building a new state-of-the-art, almost 1,000-bed hospital, the Peter Gilligan Mississauga Hospital, which will also be home to the Shaw Hospital for Women and Children. is currently under construction, and we're also midway through a project to build a rehab and complex continuing care facility at our Queensway Health Centre. So this is a massive outlay. It is $17 billion of taxpayer dollars, and we hold that near and dear. We locally, that means the hospital has to raise about $1.5 billion locally and through our philanthropic support to pay for our part of this. For our leadership team, we know this is the infrastructure for a generation and the next generation too, because it's so expensive. That bricks and mortar is incredibly expensive. And when we bring people to the site of Canada's largest hospital, one of the tallest hospitals it will be in North America, a skyscraper hospital at the corner of Huron, Ontario and Queensway in Mississauga, they're very shocked to find out this statistic I tell them, which is if we do nothing to change the trajectory of Canadian healthcare, we will open this hospital and on day one there will be 300 people waiting in the hallway. Those are 300 people that are admitted for care. These are not people that can be sent home. And this is the big red line that I have on a graph that I carry with me everywhere that we are working to change. So Rolla, to the point, what we say is we're building infrastructure, which is state of the art, and will have all of the components to deliver the highest cutting technology and medical devices and medical equipment. But if we continue to deliver healthcare in Canada the way we do with the current operating model, it will feel totally broken to the citizens of Canada and the people who live in our community. So what we're doing in a parallel track is trying to reinvent what that model looks like. And in order to do that, we have to think about the population. And we're very, very focused on a people-centered approach. The reason that number is 300 is because illness is increasing 3.6 times faster than our population in Mississauga, and that tracks pretty much across the country. And that is because of medical discovery and the amazing things that have happened over the years. We've gone from 11,000 known diseases to over 85,000. The product of so much invention, discovery, and the advent of a longer life is also that people are living with illness. And that's not just older adults. We know in Canada, like all parts of the world, we have an aging population. What we see in our statistics are that working age people are more often living with 2 or more chronic diseases, which means the healthcare system is a fundamental. The last thing I will say is in Mississauga, we are the 3rd largest employer. And the 2 employers that are bigger than us are Toronto Pearson Airport and Amazon. So they are huge, huge provincial employers, and we're the 3rd. If you woke up and read the news, I honestly, at the Canadian Club, am I going to mention the person south of the border that shouts things on social media? But he shouted about his job growth in United States today, and the number is like 130,000. And just to give you a little soundbite that's very relevant today, 85,000 of those jobs are in healthcare. And that tracks to Canadian numbers very significantly. So we have an aging and we have a more ill population. That illness is growing 3.6 times faster than the rate of our population growth. We're the biggest employer and we're the fastest growing part of the economy. And these things all have to come together to say, how can we create an economic engine by thinking about healthcare as a health productivity engine, not a consumption of our resources in a waiting system that's disconnected.
Can you touch a little bit on week 1, for example? You open this hospital.
Yeah.
You think you will still have the exact same issues that you have? Emergency overflow, staff exhausted, hallway medicine, all that. Just can you take us through what that would look like?
So we literally, as we're trying to build a new operating model for how we operate and then building the bricks and mortar, we're taking that red line and trying to track it so it literally starts to come down. That doesn't mean that we stop spending on healthcare in hospitals. It means that we bring that cost curve down in hospitals. And the way that we do that fundamentally is being a part of the solution and shifting care outside of hospitals and upstream. And so our strategy is very geared towards a complete connected care model. It is enabled by digital care, and it is enabled by us connecting with all parts of the healthcare system to try to prevent people from coming to the hospital. And then when they do come to the hospital, ensuring that that stay is as short as possible, and not as short as possible to be restored to the community without support, but to be connected back to the community in a way that keeps them healthy. This is very possible, and it is done in other parts of in other parts of the world, but it requires us to fundamentally reshape how we actually connect to different parts of the healthcare system. So our goal is that, one, when we open this hospital, you will not think of the emergency department as the only way that you can access care when you need it. Two, that you are enabled by digital technology to a digital front door and all of your information that routes your care and now can give you support to help keep you well. And then three, that when we do have to deliver care in the hospital, highly specialized, that's always going to be where your most specialized clinicians and technology exists. But when you are in the hospital, our goal will be to get you home safely as possible and maybe even prevent you staying at all through remote care monitoring and actually delivering outside of our walls with like a virtual command center in the hospital. So those are all of the things we're building now so that on day one is a very, very peaceful, calm, organized, and digitally enabled system in that big 1,000-bed hospital. Okay, that's the dream. We can do it.
Amazing. Thank you, Deb. So you're saying I shouldn't go to the Oakville Trafalgar, I should come to your hospital next year.
We're going to share this information with everyone.
Yeah. Amy, anything you want to add as a nurse? You've spent most of your life in ER and...
Yeah, I'd like to add the fact that, this work can't be done without nurses. We are the largest public sector care workers. Could you imagine us not showing up? Like, what would healthcare look like if nurses do not show up on day one? That'd be scary, right? Yes. You need nurses, but we are facing a fundamental crisis within nursing right now. And I know some people call it burnout, and it's way more than that. We are dealing with moral injury, moral distress. Yeah. The things that nurses have dealt with over the last 10 plus years, I'd say. But only with COVID, it's gotten much worse. And I think that if we don't deal with the nursing crisis that we're seeing, because again, we're seeing continuously that there are nurses that are leaving the workforce. The numbers we're not increasing the workforce for nurses, we're actually losing more and more nurses. And that is a huge issue. If a nurse doesn't want to come to work, or some of my colleagues have talked about moving to, I'd rather be a Walmart greeter than work in the hospital. Wow. I'd rather do these other types of jobs. So if we don't fundamentally deal with the crisis that we have in terms of the moral distress, in terms of us as nurses working with, we have so much more, like you mentioned, the complexity of the patients, but not necessarily having all the resources that we can to deal with it. So like technology is a big piece to that on day one, when that hospital opens, that you're going to continue to hemorrhage nurses. Yeah. And we have to be there. We want to be there. But if there's no strategies in place to, look at our workload to ensure that there's patient safety, because that's where the moral distress comes from, knowing that we have a patient that comes in and we can't do all of the things that we want to do with them, that we know we're leaving things off, that we know that there's a critical incident that's going to occur, that it makes us not want to come to the bedside. And that's a huge problem. So we have to talk about nursing retention. We have to talk about nursing safety, because the climate also is changing in terms of the culture with the interactions between patients and nurses. We're seeing more instances of violence and harm occurring. And we have to talk about nursing well-being. Mental health is a huge thing, and we don't talk about it nearly enough. And I would say that many of my colleagues are still suffering from moral injury. They still come to work, but I would say that a lot of us are not okay. And that's why you continue to see that hemorrhage where, maybe, and a lot of the nurses in the older workforce have already left. So we have a skill mix issue where we have, a nurse who might have just come off on orientation and she is charge of the emergency department, which is wild. So we have to talk about how do we keep nurses at the bedside? What are the retention strategies? Looking at nursing patient safety ratios, mental health. I remember working at one organization and having, I think it was something like $200, $25 per visit for mental health support, up to a maximum of I think it was like a $500. So imagine that. We are the largest public healthcare workers, and we have virtually no mental health support.
Wow.
So again, if we open a hospital on day one and we don't have patient ratios, workplace violence and safety under control, we don't deal with the critical mental health where nurses continue to leave, then day one, the hospital will be probably in a worse place, I'd say, than it would be today.
I remember when I was at Cisco and I started the mental health program with CAMH. At the time, I was on the board of the foundation, and I actually called the CEO globally and I said, I need you to approve something. And it was $25,000 a year for mental health employees. He said, you're crazy, but we did it.
We need that, yeah.
Because mental health is health, and it's extremely important in every organization. You want to multiply your productivity by 10, focus on your employees, on your people's mental health, because they will come to work and ready to perform at 10x. Mike, I'm going to shift the conversation a little bit on towards the economic strategy of healthcare. You've been a builder most of your career, all your career. You've done an incredible job of transforming the industry. You do a lot of work outside of Canada as well. But right now, we say that you need a strong economy to fund healthcare. What are we missing about the fact that actually you need a strong healthcare system to have a strong economy?
You know, just listening to Carly and Amy this morning, you can't, I don't know if anyone could listen to all of that and not feel the weight of the burden of solving these challenges as Canadians. We're in a moment in time, and a pretty important moment in time. I'm 52. I've never felt more of an urgent moment in our country. And we talk a lot about sovereignty and security. We don't fix what we're talking about. The things that we associate with Canada that we love don't exist in the future. I heard a minister who shall remain nameless say to me yesterday, you know, we're about 50%, healthcare is about 50% of provincial tax dollars, and climbing. He's like, do you know what it's like to be in a cabinet meeting? You know, a lot of other people in the room, about 30 or 40 people in the room, education, industry, et cetera, when one person's got half the budget, and by the way, it's going to be more than that next year, and more than that the year after, and more than that the year after that. It's kind of hard to progress the province, the services we want, economic growth, a better future for our kids. It's kind of hard to do that when you've got this one Pac-Man, you know, in the corner that's just eating all of the capital, all of the dollars that we have coming in. So we're currently at a point where healthcare is an absolute drag on the economy. Canadians are not happy. In fact, if you look at 2024, it was the biggest election year in democratic elections in the world in recorded history. Over 1.6 billion people voted. In every one of those elections, this problem that we're talking about was a top 3 issue. It's a top 3 issue here. I know for our staff and our members of my community, it's hard to get an appointment, hard to get seen. You're waiting 11 months. I can go through other stories, experiences with elderly parents and what it takes to get care. And these are people that have paid taxes their whole life. They've contributed, they've built, and they're not getting the care that they thought they were paying into, buying into, part of the promise of Canada. So right now it's a drag. It's getting worse. We need more labor, but there is no more labor. Even if we had it, we couldn't afford it. No. We couldn't afford it. So you got to ask yourself, we have a fundamental problem. We hear about these answers around the world to this problem. This is not like The future is already here. It's just unevenly distributed. Other countries are solving this. Why are we not solving it? Why are we not moving to a model that is more about a continuous journey, more about health care, not sick care, more about enabling that individual Ontarian, Canadian, with their health every single day, closing gaps in care, preventing people from showing up to Carly's ER. I remember one of the first examples I heard from Carly was the example of an elderly woman who lives at home in an apartment. Her kids are, off in other parts of the country. Her husband has passed. She's on a water pill. She can't get an appointment to see her doc. She doesn't know where to go. That person ends up, or can end up, and has ended up in Carly's ER, and unfortunately has suffered and has passed from congestive heart failure. What they needed was encouragement, contact, engagement to get them into their local pharmacy, which is just down the street, get a meds check, up their dosage on their water pill, and see their grandkids at their next birthday. So we've got a fundamental problem. The solutions are already out there, and if we start embracing these solutions, and it's not about technology anymore, really. The technology exists. It's not about inventing something that hasn't happened or it's only in science fiction. It's about having the courage and political will. And I think we are in the Overton window, so to speak, where the kinds of change that we need to change the system from episodic, the doctor visit is what starts the chain, and the billable event. There's no billable events for keeping people out of Carly's ER. There's no billing codes for that, as far as I know. We need to fundamentally change the model so that we can, back to your point, have healthcare be a driver of this economy, enable us to invest in all the other things that we want to invest, have Canadians at their best to drive the economy forward.
I love that, but I want to focus more on the solutions. So Dominic, I'm going to ask you a question around how do we build towards more of the people of the country versus the institution, and remove your political hat on, because I know you're very political, somebody told me. A little bird that's sitting on your right. So let's focus on that. If we build for people versus institutions, and I want you guys to think about the next round is going to be a rapid round on focusing on solutions and how do we actually get technology in to get faster to where we need to be. Dominic.
You want what I really think?
Yeah.
Yeah, and we can make this spicy.
Please tell me. Yeah, of course.
Okay, so I actually see things differently than what we've, I think, so far shared on this panel. It's true. We need to accept the reality of what's going on in healthcare. That's true. And things are challenging. People can't find a family doctor. We have challenges in getting access and wait times, and we have people working on that. Amazing leaders like Carly. I see some of our leaders from Women's College Hospital and our foundation in the audience here. Organizations like Deloitte and others who are contributing to a better healthcare system. Things are still challenging, and there's realism to that. On the other hand, we have an incredible healthcare system here in Canada. Raise your hand if you feel proud of the Canadian healthcare system. Around at least half, I think. And
No, I didn't see half.
Okay.
Inflated numbers.
We don't have digital tracking.
Where's Claude? Is Claude on here? Claude? Yeah.
So let me give you some reasons to be proud of Canadian healthcare, if you aren't already. In Canada, if you can get through the wait, which oftentimes is enormous.
You just lost me.
Yeah. You lost me too.
If you can get through the wait, you can get world-class care from world-class doctors and nurses and pharmacists, some of the best in the world, at world-class hospitals as well, some of the best in the world with world-class outcomes. So what are we really talking about here? We're not talking about a healthcare system that's failing. We're talking about a healthcare system that needs saving and protecting, and where we need to tackle The challenges like waits, like the 19 hours of administration per week that doctors are doing, like the massive crisis in moral injury and joy in work, and making the professions in healthcare joyful again. And that's what we need to be working on, but it's not scrap it all together. And there's so much hope in our healthcare system from what we're doing, at Carly's site at Trillium, at my home base at Women's College Hospital. We're launching an AI living lab and innovating in technology and primary care. One of the things that I get to hear as department head at Women's is how we're making a difference in people's lives. And today, this morning, I got an email about some of our grateful patient quotes. So we're connecting people to family doctors at Women's. And some people are telling us that, our secretary told us that, one person shared, "You've changed my life by connecting me to a family doctor." I'm so grateful for this call because I haven't been able to get care in years. And now I could get my chronic conditions under control and avoid emergency room visits. And by the way, we have billable hours for preventing hospitalizations and hospital visits. It's called primary care. It's called having a family doctor. So there are so many things to be proud of. There are sparks of change in our healthcare system. And right now it's up to us to acknowledge what's going on, what we're challenged with, but then also create flames from those sparks and make a difference for our entire healthcare system. And I think I missed the mark with my first question, but I'll ask you this one, which I think will have a better answer.
Hey, Ben, because then I'm jumping in.
Yeah,
I love debating with Dominic.
And so here's the question. Raise your hand if you feel more proud to be Canadian than you have in the past this year. So that probably gets the majority of the room. Rob, you didn't raise your hand. That's because you're now in the UK, right? But so we have a moment where we can build on Tommy Douglas's vision of healthcare as an economic engine. For Canada, we can build on the sparks, the pockets of greatness that are already happening here, and be real about the things that aren't working in our workforce, in our institutions, and for patients, but accept that we have something that's to be protected and cherished and built on, and not something that's a sinking ship. Thanks very much. Yeah, we'll take.
Thank you, Dominic. Okay. I'm going to start with you, Mike.
Okay.
What are we missing? What do we need to do? What's the solution? And how can this room and you help? And that's the same question for all of you guys, so start your response.
Yeah, look, I appreciate there's a lot of good in our system. But it's time to rewrite the Canadian Healthcare Act for the new century. Yeah, you can.
Woohoo!
Yeah.
There you go.
Yeah, look,
help her out.
let's be honest, it's not good enough. It was written for a different time. It was very focused on hospital beds and doctors, two things that are important, but the unit and the person at the center is each and every one of you. That should be the defining characteristic of this new model. Digital first experience for every Canadian. Interoperability, the Connected Care Act is on the horizon. It's ridiculous. We do business in a number of countries around the world. They're all ahead of us on this. The data is not flowing, and that your data and a view of who you are and what you need next and how to help you is not readily there, and we're still faxing shit around. Third, we need a connected care model. Nurses, pharmacists, of course, doctors, and technology have to be a part of that. So we need to kind of flatten the model versus the current hierarchy. And then lastly, no one said AI yet. I cannot believe it. It's been like 45 minutes. AI promises not only to help us with efficiency right now, but the promise of an infinite care team over time and ways to support people and, frankly, ways to keep people out of Carly's ER, helping them get prevention, manage conditions, get connected to maybe other sites of care like my local pharmacy, or go to see my favorite RN at a walk-in clinic. So rewrite the Canada Health Act.
Amazing.
Right now.
Amy?
As someone who is also a medical contributor, if you type in the word wait times into your Google search engine, how many times do you think it'll come up?
3 billion times.
Billions of times.
Yeah.
Okay? Billions. People are not happy. I run a podcast where I speak to, healthcare experts, but I also speak to patients and families. If you listen to the last 4 episodes that I've had people who have come on who talk about the loss that they've had in the emergency department solely due to waiting. I spoke to a mom who, she brought her son to the emergency department. You probably have heard this story, where they waited over 8 hours for him to be seen, where he had sepsis. Sepsis is a preventable death. We can prevent sepsis, but we do not have national standards in relation to sepsis guidelines. They waited when they finally found out that this child had sepsis and he was sent off. He was no longer able to be saved. He was 16. This is a loss that no mother should have to go through. So we have to talk about wait times because people are unhappy. I remember many years ago that an 8-hour wait was not something that I had to encounter when I went into the emergency department. So we have to talk about wait times. We have to talk about the fact that people are and should be at the center of healthcare.
So what do we do, Amy?
We have to look at the evidence and the data, and we have to include more. We can't just stick with the model that is here right now. There are other models of care. We have over 10,000 nurse practitioners, and many of them that do not have work. Nurse practitioners can be a part of the solution, and they should be a part of the solution.
Awesome. Dominic?
Pick up on something Amy shared earlier. So there is a workforce challenge in healthcare. There's a crisis across doctors. Something like 40% are thinking of scaling back or retiring in the next few years. That means our workforce challenges are going to be even growing. Across nurses, I think the number is 1 in 3, right, that are thinking of switching careers.
More than, yeah.
Over
higher.
1 in 3. So we have big challenges. So one of the biggest pieces to the puzzle is how do we add joy in work to our health professions? How do we make healthcare, becoming a doctor, becoming a nurse, becoming a pharmacist, something that people see as joyful and meaningful and get the stuff that we don't want to be doing, that we didn't necessarily train for, the admin, some of the safety pieces off of the plates of health professionals and let them focus on the care. And I think of the secret of quality. You think of the best food you've ever had. Probably it came from love, right? Probably it came from someone who loved what they were making, believed in it, and because of that made you a great meal, right? Whether it's at a restaurant or something that's home cooked. So the secret of quality in healthcare is also love and joy. So let's get joy back into the professions. And by doing that, we'll actually be tackling a lot of the big challenges in how we care for people. And by the way, I do want to say that
Mike is dying to tell you something.
I will say,
like he's going to fall off the chair.
So I would be one of the people last year that would have shared a story about how our healthcare system isn't working amidst our Stop the Crisis campaign. And at the same time, in the same breath, we do have to acknowledge the countless people who were saved. Their lives were saved by an amazing nurse, by an amazing doctor, by an awesome team in the emergency room or at the family practice, by those teams that are working hard and making a difference. Yeah, many people fall through the cracks. Many people wait too long. As a whole, our healthcare system is something to be proud of and built on. And then we need to tackle those outliers as well.
I'm all for love, and I'm going to the city of love tonight, Paris, in case you were wondering. But I think we got to get to specifics.
Let's get spicy. Let's get spicy.
Specifics, and I'm actually going to go right to Carly. Carly, let us know what percentage of people that show up at your ER did not have to be there. Mm-hmm. What percentage? It's not 1.
No, it's at least 25, but if we could move upstream, it's probably more like 60 to 70.
Yep.
And so that's what, if we get very specific, which I think we have to, if I can riff off of what you just said, Mike, and Dom, I really appreciate the moment, the sentiment of Canada. I actually think it comes squarely into alignment about how people feel about healthcare. They're most proud and most dissatisfied that we actually have let our guard down. Mm-hmm. Okay, so people want to be winners. as Canadians at this moment. I think if I did a poll, I'm not going to do another poll, we'd all agree. We've got to be winning, and we're not winning. So one of the things that very much, a few of us from Trillium were just in Ottawa last week, and we're advocating for, you need a new measurement system. We are measuring around providers. It is phenomenal that we are very focused on attachment to primary care physicians. That is not to be ignored, and to my primary care physician friend, it is very important. It is not going to solve a problem of disconnection for people who live with 3+ chronic diseases. We need a new kind of scorecard that actually says, to Mike's point, exactly, we measure very specifically how many people did we care for that have what we call an ambulatory care sensitive condition. You came in because you have COPD, you have chronic heart failure, you have a chronic condition that you should have been cared for in the community that you didn't. And now you're going to come and wait. And you're going to wait in our hallway, and you're 73. So you're going to get dementia because you're going to be in the hallway for over 24 hours. And then you're going to be admitted to Amy's unit. And in Amy's unit, you are going to have an interaction with a nurse where you hit her. And that will put her on a sick leave. And we will now spiral down. By the way, you are going to go home to a long-term care facility that costs more and is not the place that you wanted to have your last days of life. This is the common Canadian experience for lower and middle-aged older adults right now. So that's the dissatisfaction. If you need cancer care, there's no better place in the world. I totally agree. We have the most talented people in Canada, including in healthcare. But a scorecard that says, this is how many people receive care in a hospital right now that should have been receiving care outside of the hospital. This is how many connection points there are between primary care, pharmacies, hospitals, et cetera. The big Connected Care Act that was introduced in Ottawa last week. Here's how many people are actually connected. Here's how many people in Canada die in hospital. Okay? This is such an achievable target. We know that the number of people who die in hospital in Canada is overwhelmingly in hospital. And we initiated a piece of work in Mississauga in the last 18 months, and 92% of people enrolled die outside of hospital. It is lower cost, it is dignified care, it is centered around their needs. It is exactly what we need to do, but we have to measure that. So my solution starts with measurement. It has to be organized around people. And on connected care, it's kind of like the Securities Commission issue in Canada right now. We can't have just national legislation that says, let's have connected care. Everyone in this room should be demanding, I want to be a part of the group in every province that is going to show me how that actually translates into action on the ground.
I love that. And I love how you started and then kind of ended around the digital front door. I think you need a front door, back door, side door, and the roof door in order for you to get this out of the way. But let me tell you, and I'll wrap it up. I know we're running out of time. I've been getting signals here. Shame on us as leaders, as Canadian citizens, as doctors, as nurses, that we don't use innovation enough in AI to get us to where we need. I graduated from the same, not literally, same school of technology, being street smart, and I know that technology can move us a lot faster. So just a very quick example for you. I broke my toe last week on Friday. I was on an island on the beach. I asked them to take, before I get on the plane, to take a picture for me, an x-ray. They didn't know how to read it. I said, let me take a picture of it. I put it in Claude, which is the Anthropic tool, if people don't know what it is, in ChatGPT, and told me already that my toe is broken. But because I have lymphedema, I also prompted it to tell her that I have lymphedema and I have rheumatoid arthritis. She said, the minute you get to your country, make sure that you get an x-ray and you get an ultrasound. By the time I landed, I knew exactly what I needed to do, and I just went in to get the ultrasound, confirmed that I had 2 blood clots, and also told me which medication that I needed to be on. So when I went to the doctor, to the emergency room, I just needed a prescription. That's all I needed. It's because I was guided and I knew how to use AI, I knew how to guide it, I knew how to manage it, and I knew how to evaluate it, because that's what we need to do to take the load off of the system if you have something small. But again, I will warn you, it's all about trust, but you need to verify, which is the human reinforcement learning behind every AI tool. And hence the reason why Carly's putting an innovation committee together, people like Mike, myself, and people that are very, very, very well respected in the industry that move the needle. So please make sure that you have a voice, you have a strong voice. Don't wait for a permission from anybody. Because if you wait for permission, we will never be anywhere in this country. Just go out there, as my father always reminded me, life owes you nothing. Life is an opportunity for you to go out and make the best of it. So make the best out of your voice and out of the impact that you can make on this country. So thank you very much. Sorry, no time for questions? No time for questions, sorry. I know I had 2 questions there, but you can cordon them outside.
Thank you. Yes, no, thank you. On behalf of Canadian Club Toronto, Carly, Dominic, Amy, Michael, thank you so much for that very spicy and thought-provoking conversation. And Rolla, thank you for moderating today's important discussion. Thank you again to Johnson & Johnson and Shoppers Drug Mart for making today possible. And a special thank you to our production partner, VBC Live, for their excellent support today. Please remember to complete the survey using the QR code on your table. We really appreciate your feedback. And before you head out, let me just share a couple of really great events that we have coming up. Next week, we have on February 18th, we welcome the Honourable Lena Metlej-Diab, Canada's Minister of Immigration, Refugees and Citizenship. On February 24th, we turn our attention to rethinking Canada's tax system. And then on February 26th, we'll close out the month with the Honourable Dominic LeBlanc speaking about Canada-US trade and what it means to be one Canadian economy in this complex environment. Full details at canadianclub.org. Thank you so much again for joining us today, and we hope to see you again soon. Thank you.